In this lecture, we're going to be covering diseases, standard precautions, and the personal protective equipment we see in the field. As providers, we oftentimes are going to see and treat patients with communicable or infectious diseases. Many times, we're not even really aware that they have an infectious or contagious disease until after the call. To clarify, an infectious disease is a medical condition caused by the growth and spread of small but harmful organisms within the body, where a communicable disease is a disease that can be spread from one person or species to another. All contagious diseases are infectious, but only some infectious diseases are actually contagious, like pneumonia, COVID-19, hepatitis B. These are going to be diseases that can be transmitted from one person to another and are the ones we need to worry about whenever we're working in the field, because they're the ones that we could take from one patient, get ourselves, and then give to another patient. Ways to protect yourself from some of these diseases are first, immunizations. Ensure that your body has encountered some level of that disease and been inoculated to it. It won't always mean that you're not going to end up getting sick and that you're not going to end up, but it will lessen the severity whenever you do encounter and get infected with that disease, because your body is already prepared to fight it off. Other ways we can protect ourselves is PPE, our personal protective equipment, trying to ensure that that foreign little invader can never actually make it into our body to infect us in the first place. Good hand washing techniques and proper cleaning and disinfecting of an ambulance and all of the equipment after every call that we have. Just because you don't see something, you don't see blood, you don't see dirt, it doesn't look dirty, does not mean that it can't have that infectious material on it. We also need to try to make sure that we're informing the other healthcare providers and coworkers that we have whenever we do have a patient with potential risk or a known disease. But when you do this, please use discretion. You don't need to scream out from the mountaintop that you're transporting a patient with hepatitis C, with HIV, with COVID-19, with active tuberculosis. It is still their protected health information. It can be given just like any other protected health information to the other providers that are part of their care team, but it needs to be done so in a manner that won't alert people who should not be privy to that information. Please ensure that you're not giving out any sensitive patient information over the radio or to anyone who is not directly involved within that patient's care. Infectious diseases can be transmitted in a number of ways. Some of them can be transmitted in multiple ways. When we say transmission, we're talking about the way that the infectious agent is spread from one person to another. That can be through either indirect or direct contact, through airborne means, foodborne viruses, or vector-borne, which means it's transmitted through some type of insect or other parasite, worm, things along those lines. Direct and indirect are two of the ways that we can transmit. Direct contact means that an organism is moved from one person to another through touching without any intermediary. Think bloodborne pathogens, sexually transmitted diseases, where that person's body's substance is coming in direct contact with somebody else's body. You're breaching those systems. There's direct contact between you and it, or it and somebody else. Indirect means there's something in between. There's some type of intermediary. Blood that is left on some type of surface, a needle stick. That person's blood ended up on the needle and then the needle stuck you. So there was something that got that infectious substance from that person to you. Airborne transmission is exactly what it sounds like. It's spread through droplets, through dust, something floating in the air. Common cold, pneumonia, COVID-19, these are all spread via coughing and sneezing, making it airborne. Lovely little viral agents, bacterial agents are sneezed out of their host. They float through the air and then you inhale them. Hopefully you're not eating a whole lot at work, but for those foodborne, it's where, think E. coli, botulinum, where they're in the food that you're eating, hepatitis A. Whenever you ingest it, you're then infected with that particular agent. And then vector-borne, you're bit by a tick. Once you've been exposed at work, what do we do? First of all, do not forget, the way that you keep from having an issue is to not be exposed to it in the first place. So wearing good PPE that we're going to talk about in a little bit. All of you, whether this is your EMT class, AEMT class, paramedic class, at the very beginning, and they start talking to you about how you do your scenarios, all of us, hands up, BSI, my body substance isolation. I am making sure that my body does not come in contact with something that is sticky and wet and not mine while I'm on shift. If you do get exposed, your service that you're working for should have some type of infection control plan. All of them are required to have a designated infection control officer, their DICO, who has laid out this plan and ensured that when exposures occur, they're able to swiftly intervene, interact. The first step, as soon as you know that you've been exposed and you're able to, please go wash your hands, wash the area that has been exposed, that's had the blood, the body fluids on you. As disgusting as it is to get somebody's urine or feces on you, and same with saliva, unless there is visible blood in it, it's unlikely that that was an exposure. Especially if where it landed, you did not have some type of open wound. But still, it's nasty to have that person's body substance on you. So go wash it with soap and water as soon as you can. If you're on a scene and you don't have soap and water available, use waterless hand sanitizer to try to clean the area. Start disinfecting it as best you can. And then as soon as you are able to get to soap and water, wash it. Wash for at least 2-3 minutes. Sing happy birthday a couple times. You want to really get in there, and the water should be warm. It shouldn't be so hot that it's going to burn you. But we do want to use warm water whenever we're doing it. If it is something that you were exposed to splashed in your eyes, you need to rinse them for at least 20 minutes if at all possible. If you're transporting the patient to the hospital, almost every hospital does have some type of eye wash station that you can utilize. If you don't have access to an eye wash station, you can utilize saline. Flush your eyes as best you can. Hooking up some saline to a nasal cannula, and then you put the nasal cannula prongs right over your eyes, will allow that to easily flush. Do not let that water that you're flushing from one eye that was contaminated run into the non-contaminated eye while you're doing this. Ensure the contaminated eye is the one that's pointing down towards the ground as you're flushing your eyes out. You then want to follow the rest of your department's reporting guidelines. This is going to be notifying normally your supervisor, getting the infectious control officer involved. If needed, they need to start working on getting source testing as soon as possible. So if you think that you have possibly been exposed, let them know as soon as possible. As soon as that call is done and you're able to notify and start those processes, please do. This may involve you going to get some type of medical evaluation. It may involve you getting some blood drawn so that they can then compare it, start running it. Depending upon what you may have been exposed to, it may also involve prophylactic treatment. You also want to make sure to thoroughly document what occurred. Again, follow your department's guidelines, but writing up some type of statement is going to be essential. They're going to want to know how you were exposed to that, because if it is something that is a fault within your system's current guidelines, current SOPs, they're going to need to augment to ensure that future people, other people, do not also have a similar occurrence. Like if the needles you're using don't have good quality safety caps, they might need to look at switching those needles to a different brand that would limit the amount of needle sticks that service may have. Part of protecting yourself is going to be wearing good PPE, and we're going to look at the different types of personal protective equipment in just a minute. Our idea around PPE and what is important and what is needed and being utilized has changed so much since EMS first was started, even honestly since I've been in the field. I can remember in my early days watching partners wear absolutely no gloves when doing things like starting IVs and other assessments on patients that did have hemorrhaging or some type of blood on their skin. We would not do that anymore. We know better. And honestly, COVID-19, working and being in the pandemic, whatever your feelings may be, we did learn a lot about protecting ourselves and maybe what are some good practices that we can utilize. Providers getting sick with the flu was at an all-time low during COVID-19. You can look at whatever conspiracy theory you would like, or it's because we were all wearing masks, and flu is also a droplet-borne disease that's got that airborne vector. So since we were wearing masks, we weren't encountering the flu droplets like we otherwise may have been. Our PPE was working in front of our own eyes. Some of the growth that we can have, so again, 1800s, surgeons would make it a show of pride that they had messy operating aprons that showed that they were doing something. And you know what was happening to their patients? They were getting sick because they were getting exposed to the illnesses that the previous people had. They were generating operating room borne illnesses, passing them from one person to another. So we don't want to do that. So if you have clothes that are grossly contaminated, you need to change. You need to get out of that before you encounter your next patient. We want to make sure that we're not spreading one patient's illnesses to the next patient that we're encountering. We'll continue to see recommendations on updated PPE and what's recommended as research becomes available. Again, COVID-19 and working, and it doesn't need to be the full response with the PAPRs and everything, but as simple as a mask during things like flu season can very much limit provider illness and the transmission from one person to another that we are seeing. Other ways that you can help prevent annual examinations, talked about this in the provider wellness, that getting an annual exam, no matter what your age, is going to be important. Making sure that you don't have an illness that you're bringing around with you. If you don't feel well, going and getting assessed to see if it's something that is contagious that you could spread to the patients and your coworkers that you're seeing. Getting the recommended immunizations. These are necessary for your immune system. When we get immunized, whenever we go and we get our shots for things like chickenpox, MMR, so mumps, measles, rubella, our Tdap to make sure that we have tetanus, but then also diphtheria and pertussis, COVID-19, the flu, you are giving your body a little key of what that particular disease is so that your body can make cells to recognize if you're ever exposed to it again. This doesn't mean that you're not going to get sick if you're exposed to it again. It just lessens the severity. So instead of possibly dying from the flu, and people die from the flu every year in droves, people who get vaccinated to the flu, as long as they're right whenever they're picking what possible flu strains we may see this year, tend to have less severity in their symptoms. They don't get hospitalized quite as often. They certainly don't die quite as often. It's gearing your body up to be able to fight it. It's like going to take a test and you were already given the answers to the questions. You might not have known what the questions were, but you were told what the answers were going to be. It's still going to take you a little bit to take the test. The test may still suck and may still not be great, but you came in prepared. As opposed to the pop quiz that you had no idea was coming and you're not even sure what material is going to be on it. It's just helping your body jump starting it in its response to those particular antigens that it's going to see. The immunizations that your service is going to either require or strongly recommend will be disclosed by your service. Most healthcare fields, it's going to be chickenpox, MMR, Hep B, Tdap, seasonal flu, and then also, pardon me, hepatitis C. So some PPE and just getting good PPE practices. First of all, no level of PPE will substitute good hand washing. Even if you wear your gloves, even if you don't think you got anything from that patient on you, after the call, you need to be washing your hands. Soap and water, good hand washing, scrubbing the back, trying to get the nail beds is going to make sure that if you did happen to get exposed to something, you're not then going to take that and introduce it into your body when you're trying to quickly eat whatever hospital snack you were able to grab, or to your next patient that you're seeing. At a minimum, whenever we're encountering patients, we should be wearing gloves. We can't always see what's going to be on their skin and what's going to be exposed. And at this point, most patients are expecting us to wear gloves, especially if we're doing things that are going to be invasive, starting IVs, inserting different airway devices, assessing them when they do have some type of injury. It is as much for our protection as it is for them and their peace of mind. And think of it as a part of your uniform at this point. You need to be wearing gloves. Depending upon what the patient complaint is and what you think you might possibly be exposed to, you might also add on a face mask, whether that's a simple surgical mask or something like an N95 or an N100. So going to have those extra filters that are going to help with the really fine particulates that we may come into contact with. You may have gowns, and you may also have facial protection, such as goggles, if it is something that's going to be airborne. The level of PPE that you're wearing needs to fit the patient that you're going to. So if you're going to a patient who tripped and fell and they've got a scrape on their knee, gloves, perfect. Do we need to bust out the gowns and the eyewear? Probably not. But if you're going to a patient who is imminent delivery, you might want the full PPE experience on: gloves, gown, eyewear, face mask, because you don't know how much liquid is going to be involved and what you might get exposed to. Again, important infection control practices. Wear your gloves. Wear your gloves. Just wear them. Again, think of them as part of your uniform. Always make sure to wash your hands as soon as it's available. If you are running high numbers of calls and it is starting to be winter time, or you live in a low humidity environment, utilizing hand lotion throughout the day. When we frequently wash our hands, especially with the soaps that are going to be available at the hospital and at our station, so those good antibacterial soaps, it's going to draw a lot of the moisture out of our hands. If we don't then utilize hand lotion and make sure to restore some of that lotion, you're going to end up with little micro cracks, which are going to be ways that things you're exposed to can start to invade your system. We want to make sure that we don't have that occurrence, that we're not getting any type of damage to our skin, even if it's something we can't visualize. Utilizing eye protection when needed. So if you have somebody who you could be in the splash zone for, again, imminent deliveries, lots of trauma, you're doing any type of airway procedure. So you're going to be ventilating, you are putting in a biad, you're intubating the patient. It's a patient who's actively coughing, and you're worried about things like TB or the flu or COVID-19. Slapping on some eyewear could be very beneficial to keep you from getting anything into your eyes. Wearing a mask when needed. People who were working in the field during COVID, I think, got very jaded and very burnt out on surgical masks and wearing N95s. Honestly, guys, for the risk that you could be getting and exposing yourself, masks really aren't that bad, especially when you're just wearing them whenever you're around the patient. It limits your likelihood that you're going to get sick, even if it's just from the flu or from a cold. None of us like being sick, so wearing a mask is a small price to pay. And again, protecting your body in any way you can. If you need to wear the full gown, wear the full gown. It's not just about keeping us from getting sick. It's about keeping our future patients from getting sick as well. And that can include just keeping things from getting on our gloves. N95s and 100s mostly used for COVID now is what we think of them for, but TB was kind of the big thing that we used to think of when we were going to bust out the old N95. It is one of the most common diseases contracted around the world. Unfortunately, a lot of the places that we're going to go into are going to be places where N95s might be needed, because TB could definitely be something that's going to be transmitted there. So places where we have high concentrations of bodies in an area, so not an open air area in buildings, jails, prisons, schools, nursing homes, homeless camps, homeless shelters are all going to be places where we may have TB that can be prevalent and can be transmitted rapidly from one person to another. So if you go to a patient who is coughing, shortness of breath within those areas, it might be worth carrying the N95 with you so that if you do need it, you have it with you as soon as you can put it on. Please ensure that if you are wearing an N95 or an N100 or any type of respirator, that it's one that you've been fit tested to. When the pandemic hit, fit testing, they tried to keep up with it as best they could, but we were having an extreme supply shortage. So it was difficult to do fit testing because technically every time you'd get a different style, a different manufacturer's N95, you're supposed to redo fit testing for that particular one that you're carrying. But when we're already having issues with the number of supplies, to do fit testing every time you got a new respirator was further diminishing the supplies we already didn't have. So there was a de-emphasis on doing proper fit testing. I'm hoping now that the pandemic is kind of come and gone and those supply lines are more open, that fit testing has resumed. If you're going to be wearing a respirator, it's got to be one that is doing its job, that's fully protecting you. So it needs to have a good snug fit. Cleaning out your ambulance, also extremely important. You need to make sure you're sanitizing the full patient compartment after every call. Cot, rails, the cabinets, everything within the monitor if it was utilized, blood pressure cuff, pulse ox. Pulse oxes are disgusting and people do not clean them like they're supposed to. The 12 lead and 4 lead cables if it was applied to the patient. Everything should be washed or wiped down. And not only wiped down, but you should be following the manufacturer's guidelines on how long that cleaning agent needs to be left on the surface to appropriately sanitize and disinfect. It varies based on what you're using, so just look at the packaging of the particular disinfectant that you're utilizing. Bleach tends to take a couple minutes and it should be in a good ratio. So if it's in a good 1-to-10 ratio with water, it's going to take 5+ minutes to fully disinfect that area. So please be sure that you're leaving it, that it's normally for a minimum of 5 minutes, but it might need to sit for longer. If you utilize sharps, ensure they're properly disposed. No more stabbing them into the bench sheet, just kind of throwing them in the bottom of the bag. We want to limit the likelihood of somebody getting that needle stick injury. So putting them into the sharps container as soon as possible is going to be important. The person who utilized the sharp should be the one to immediately place it in the sharps container. If you are wearing any higher level turnout gear, so you are wearing some type of PAPR or hazmat suit, level A, level B, level C, ensuring that once you are done wearing it, that it is appropriately cleaned and then stored. Here's your different levels of protection based on for body armor we may see in the field. Unfortunately, you are going to see more and more places that are wearing ballistics vests for EMS. And it is unfortunate, the threat that we can see working in our job day to day, and that people aren't always kind to public safety, and EMS is looped into that. If you work for a service that does utilize body armor, knowing the level of ballistics vests that you are wearing is going to be important, because not all ballistics vests are equal. And unfortunately, the lighter it is, the less protection you're normally getting. So it goes all the way from type A or type 2A up to type 4. And the only ones that have A's are going to be type 2 and type 3. So type 2A is going to be high velocity for 9 mil, 40 mil. So high velocity handgun ammunition. Larger rounds, not going to be super protective from that. Type 3 is then going to be a little bit of those higher velocity or larger rounds, so up to like a 44 Magnum. And then once we get up to type 4, we're looking at things that like only thing that's going to be able to penetrate it is armor piercing bullets. So things that are made to get through those types of plates. Hopefully that's not something you're having to seriously consider or worry about on your job, but it is something that unfortunately we are facing more and more. Day-to-day wear that you're looking at. So wearing, again, your gloves, If you are somewhere that has a lot of traffic accidents and you're expected to go into the car to help with the extrication, making sure that you do have gloves that are suited. So, thick leather or other work gloves that are suited to those extrications, wearing boots that are protective of your ankles, your toes, so some type of composite toe is needed. If you are in an area, again, that's going into doing those extrications, or anywhere that you could have something that could fall on you. So if you work in like an industrial plant, having a helmet that is rated for the area that you're working in. Speaking of the ballistics vests, so again, we are finding ourselves an increased number of hostile situations. Hopefully, most potential hostile situations are identified using dispatch information. They're using things like the patient's being uncooperative, the patient is making verbal threats. We hear people screaming in the background and it sounds unsafe. Unfortunately, we don't always know until we get there. If you are responding to what appears to be a hostile situation, it's going to be best for you to stage a safe distance away. If you can see the scene can see you. That is not a safe distance away. You need to be far enough away that you're not within direct eyesight of the scene. You then should stage in that area until law enforcement deems the scene safe. Even if dispatch doesn't tell you that the scene is unsafe and you need to stage, if those spidey senses are going off and you're responding to things that do sound very unsafe, fights, stabbing, shootings, riots, domestic disturbances, unknown medical calls or unknown trauma calls, anything that is making you feel like it might be in your best interest to have extra friends coming along with you, request them. Request that law enforcement go ahead and come. If you're going to request them and their ETA is much longer than yours, consider if you need a stage or not. If it is going to benefit the cost risk analysis of you not immediately responding to that patient versus what's likely to happen to you when you get on scene. If there's at all the possibility that you could be in danger by proceeding into that scene, you need to put your safety first. You can't help anybody if you then have become the victim or the patient. So wait for law enforcement to clear that scene and make sure that you are okay to go in. Again, any suspicious call is going to warrant an initial response by police, and hopefully your dispatch is sending them in first. Just because a scene doesn't initially sound unsafe doesn't mean that you're not going to find a very different situation once you get there. If you arrive and you start to have contact with a hostile patient, try to guard yourself as best you can. The last thing we want to do is leave the scene. However, if that scene becomes an immediate threat to you and your only option for your safety is to leave, abandonment is not good, but your safety is important. So if you need to leave the scene and have law enforcement come in, you can look at doing that. Hopefully, if it is that type of scene, law enforcement is already there or is quickly arriving with you. When you do have that hostile patient, try to allow them to talk. We need to play and be good at a certain level of verbal de-escalation and like verbal judo. Us bowing up to the hostile patient and trying to overpower them or like over alpha them does not tend to end well. And you can get a good feeling on your patient whenever you're starting to talk to them, whether they're somebody that really is all showy or if they're actually just a very angry, hostile patient. And if they're actually a very angry, hostile patient, us yelling and screaming at them is not going to make that situation any better. Allow them to talk. Sometimes if you allow them to kind of vent and let some of that steam off, they'll calm down. Do not start arguing with them. We are never going to win that fight. Even if they are wrong and you are right, that is not a fight you're going to win. Because winning for us is safely getting them where they need to be, like the hospital, and you and the patient, neither of you getting hurt. If we start to argue with them, start to ridicule, to talk down to them, to belittle them, we're likely to end up being injured, getting into some type of confrontation with that patient. And even if it's not a physical confrontation, At a minimum, you have lost the patient's trust. And in order to be a good provider and do our job effectively and adequately, we've got to have some level of trust from the patient. So as soon as you start doing that, you've lost the game. Try to de-escalate emotions, and that's not just the patient's emotions. That is yours as well. You getting aggravated and you becoming a hothead will not make that situation any better. You are the professional there. You need to stay calm no matter what the situation is, no matter what's going on with that patient. So trying to concentrate on de-escalating their emotions and your emotions is going to be important. Talking them down. Again, sometimes allowing them just to vent is going to be important. Convincing them that they're in a safe space. If the reason they're so upset and they're so hostile is because somebody else that's there, try to remove them from that stimulus that's upsetting them. However, be aware that a hostile patient who is in their home surroundings, in their environment, is much more dangerous than anywhere else because they know everything intimately in that area. You do not. Your head always needs to be on a swivel. You need to constantly be aware of the scene that you're in because it could be continually changing. They know if they have something stashed somewhere very near them. You don't. So if you do have that very hostile patient, if you can try to get them into a more neutral area, outside, away from their environment where you can try to calm them, but also be on more level playing field with them, that may behoove you from a safety standpoint. Even if the patient's hostile, all patients need to be treated with respect and dignity. So trying to understand what may be going on with them that got them so upset, whether this is an emotional response to something that occurred or it is a byproduct of whatever is going on with them from that medical standpoint. They're having some type of psychiatric crisis. They're altered because their sugar is too low or too high. They're hypoxic. They have an injury that's causing that reaction within their brain. We need to understand that no matter their affect towards us, they are still our patient. And we owe them the professional exterior that we give all patients. Even still, primary concern is your safety. For you, for your partner, for all the other providers on scene, and for the patient. So be constantly aware of the surroundings. One of the most dangerous places for us as EMS providers is actually traffic accidents. Motor vehicles and the speed that they drive carry way more possibilities for injuries and fatalities for us as providers whenever we're not aware or cognizant whenever we're on those scenes. People are very distracted driving. We see it all the time. You can watch videos. There's unfortunately been very sad occurrences within South Carolina where distracted drivers, or even drivers who weren't distracted but just couldn't bother to care, I guess, in that moment, have caused issues on scene. People constantly texting, looking down at their phones, thinking that their time is more important than everybody else around them, not just everybody else's time, but everybody else's well-being. Being aware of the scene that you're on is so extremely important to make sure that if something is starting to change, that you're aware of it as it's changing. If you have noticed that the scene you're in is starting to become unsafe, you need to alert all the other providers around you so that everybody can get to a more safe location. If you are responding to a scene, especially like a traffic accident, start noting the conditions as you're responding and approaching the scene. Especially if you're on the interstate or some other type of highway, noticing how many other cars are traveling on the highway at that particular time, what their general speed is looking like. Is it sunny outside? Is it rainy? Is there a lot of overcast? Is it nighttime? Are you on a rural highway versus some type of urban road? It makes a lot of difference in the overall scene dynamics whenever you get there. As you're approaching the scene, past just looking at the overall environment that you're in, you want to look for other cues that could lead to you having safety issues. Again, what's the traffic look like? Do you notice smoke? Do you notice fire? Are there downed power lines? Is there some weird hazy color that is not a normal color you'd see in the air? Is it a tanker truck that's overturned and looks damaged? If you're noticing any of those and it looks like the scene is going to be unsafe for you to proceed in, try to keep your distance. Hopefully dispatch has been aware of some of those things prior to you getting there. Somebody's told them kind of what's going on, and you can stage adequately far away. If it's a possible hazmat situation and you can see the scene around your thumb, when you hold your thumb up in front, extending your arm and looking, you're too close already. But it is better to then leave that scene than to continue on once you've noticed that it is unsafe. Standing water, down power lines, areas we should not be going into. You are not expected to take care of those situations. Please, once you have noticed that something is unsafe, notify somebody who can take care of it. If there's down power lines, notify the power company. Notify, if you're a particular service area, the fire department is somebody who can take care of that and start to work with the power company. Getting the electricity to those particular poles turned off. If it's standing water and you cannot drive through it, do not drive through it. There's vehicles that most departments have or possibly around you, whether it's the fire department or some type of rescue group, whether it's county-based or departmental-based, that has apparatus that's meant to drive through higher waters. Get one of those coming if it's needed. Get the safest route to the scene that you can once the scene appears to be safe. Also, alerting and calling other additional resources you may need. If you need additional people for traffic control, let dispatch know. If you're going to need air support, let them know. If you're going to need hazmat, get them coming. If you have a multi-vehicle accident and it looks like it's going to be some type of mass casualty incident, notifying the surrounding destinations that you might be bringing potential patients and what you're looking at to them so they can also prepare. Talked about power lines briefly in the last one. So you are not expected to work with the power lines. That is the power company. Letting them know that there is a down power line. Never touch with down power lines. Don't drive over them. Don't go near them. Don't touch them until you have heard for sure from the power company that those are down, that those are no longer live. Consider them to be live and energized. We don't want to mess with those high voltage lines. They can act in very unpredictable ways. They can very easily arc whenever they're damaged and down like that. Once the power company has cut the power to those particular poles and you are good to go, you can proceed in. If you do have a motor vehicle collision and there are down power lines between you and the patient, encourage the patient to stay in their vehicle. Do not come out. We'll come to you as soon as it's safe for you to get there. Other types of electricity, lightning. If you are going to a possible lightning strike, it is a myth that lightning never strikes the same place twice. It absolutely can. It can be a threat in a multitude of ways, whether it's a direct hit to you or through a ground current that then transmits and gets to you. Unfortunately, lightning tends to come with rainstorms, and water is an excellent conductor. So we want to make sure we stay away from areas where water can collect and start standing. So drainage ditches, overly moist areas, small depressions in the ground where there can be a puddle, wet ropes or other things that are wet that we can touch, staying away from large trees. We might not be able to get to those areas and start fully assessing it until the storm passes, depending upon the location. So if you have somebody who has been struck or potentially struck by lightning and they're out on the boat in the middle of the water, we might not be able to access them until the storm has passed and it's safe enough for us to get to them. If you are responding in an area where there is possible lightning hazards, one, stay in your vehicle, but recognize the warning signs that a strike is about to happen. If you start to have tingling sensation all over your skin, your hair starts to stand on end, you hear like a crackling in the air, a strike is imminent. Try to move to the lowest area possible. Trying to get away from whatever water might be there, making yourself small, crouch on the ground. Stay away from things that are projecting up out of the ground. Trees, telephone poles, anything that could be sticking up, kind of waving in the air like, hey, I want to get struck by lightning. You don't want to be that. That's why you want to be the lowest thing there without standing by all these ground projections. Distance yourself from other people. Get away from any metal objects that you possibly can. If you are close to your unit, get back inside the vehicle. As silly as that sounds, If it strikes the ground, the rubber from the tires is going to help from the ground conduction getting to you. Big takeaways from this: protect yourself in any possible way that you need to. So PPE, do not take anybody's diseases with you. Wear your gloves, wash your hands. Do not be afraid to wear more PPE if it is going to protect you. If you have any questions, let your instructor know.